1. Schizophrenia. Schizophrenia isn't just about hearing voices or having delusions, although those are some of the most distinctive symptoms. It fundamentally distorts the way a person thinks, feels, and acts. People might have trouble with their memory or logic and often feel very removed from reality. The complexity of schizophrenia lies in how differently it manifests in everyone. Some might face severe symptoms, while others can manage with the right treatment. 2. Bipolar disorder. Imagine the energy and mood of a person with bipolar disorder as being on a vast spectrum, swinging from very high, mania, to very low, depression. During manic episodes, a person might feel overly happy or irritable, have grand plans, talk a mile a minute, or engage in risky behavior. During depressive episodes, the same person might feel overwhelming sadness, lack of energy, or even suicidal thoughts. The cycle between these highs and lows can be unpredictable and profoundly affect daily functioning. 3. Dissociative identity disorder, DID. Formerly known as multiple personality disorder, DID is one of the most misunderstood mental health conditions. It often develops as a response to extreme trauma during early childhood, usually extreme, repetitive physical, sexual, or emotional abuse. People with DD use dissociation as a defense mechanism that leads to a disconnection from reality, notably in the form of multiple distinct identities or personalities, each with its own name, history, and traits. 4. Schizoaffective disorder. Schizoaffective disorder is like a hybrid of schizophrenia and a mood disorder. It includes psychotic symptoms such as hallucinations or delusions, along with mood disorder symptoms like mania or depression. The combination can make it tricky to diagnose and treat because it's crucial to address both the psychotic and mood aspects. The mood changes can often exacerbate the psychosis, making a cohesive treatment plan essential. 5. Autism spectrum disorder, ASD. Autism is a developmental disorder that affects how a person perceives the world and makes social interaction and communication challenging. It's called a spectrum because it includes a wide range of symptoms and abilities. Some people with ASD might have significant disabilities and require lifelong care, while others might be fully independent and have exceptional skills in areas such as art, math, or memory. 6. Borderline personality disorder. This disorder is characterized by severe instability in a person's self-image, moods, and interpersonal relationships. People with BPD may experience intense episodes of anger, depression, and anxiety that can last from a few hours to days. They may have difficulty maintaining relationships and often have a deep fear of abandonment. Self-harm, suicidal behavior, and a chronic sense of emptiness are other possible features. 7. Obsessive-compulsive disorder, OCD. OCD involves both obsessions and compulsions. Obsessions are intrusive and unwanted thoughts, images, or urges that cause distress or anxiety. Compulsions are behaviors that a person feels compelled to perform in order to ease their distress or prevent something bad from happening. For example, if someone is obsessed with germs, they might compulsively wash their hands until they're sore and raw. 8. Post-traumatic stress disorder, PTSD. PTSD can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. It is characterized by persistent frightening thoughts and memories of the ordeal, along with emotional numbness. People with PTSD may have nightmares or flashbacks, and mundane things can trigger memories of the trauma, leading to intense emotional and physical reactions. 9. Narcissistic personality disorder. People with narcissistic personality disorder exhibit patterns of grandiosity, a need for admiration, and a lack of empathy. They often believe they are superior and expect special treatment, manipulate others to get what they want, and are overly concerned with power or success. Despite their confident appearances, they might be very sensitive to criticism or defeat. 10. Antisocial personality disorder. This disorder is more than just disregarding norms or laws. It involves a lack of conscience or empathy, making it difficult for those affected to have meaningful personal relationships or maintain stable jobs. People with this disorder often manipulate or harm others and show no remorse for their behavior. 11. Body dysmorphic disorder. Individuals with body dysmorphic disorder obsess over what they see as flaws in their appearance, which are often unnoticeable to others. This obsession can lead to severe emotional distress and interfere with daily functioning. They might engage in repetitive behaviors like mirror checking, excessive grooming, and even seeking multiple cosmetic surgeries. 12. Seasonal affective disorder, SAD. SAD is a type of depression that occurs at the same time each year, usually in the winter. Lack of sunlight may trigger this condition, leading to a biochemical imbalance in the brain. Symptoms might include feeling sad or anxious, energy loss, and changes in sleep patterns and appetite, particularly craving foods high in carbohydrates. 13. Phobias. A phobia is an extreme, irrational fear of a specific object, situation, or activity that is disproportionate to the actual danger posed. Common phobias include fear of heights, acrophobia, fear of spiders, arachnophobia, and fear of flying, aviophobia. Phobias can trigger panic attacks and may lead people to avoid everyday situations. 14. Eating disorders. Eating disorders are characterized by abnormal or disturbed eating habits. Anorexia involves an obsession with food and weight, leading to severe undereating and often starvation. Bulimia involves periods of overeating followed by purging. Binge eating disorder involves regular episodes of excessive eating followed by feelings of shame or guilt, without the purging seen in bulimia. 15. Hoarding disorder. Hoarding is the persistent difficulty discarding possessions, regardless of their actual value. This behavior can fill homes to capacity, with only narrow pathways winding through stacks of clutter. It's often severe and debilitating, affecting the person's health and social life, leading to isolation. 16. Somatoform disorders. These disorders manifest as physical symptoms that suggest illness or injury, but cannot be explained fully by a medical condition, substance use, or another mental disorder. Symptoms are not intentionally produced or feigned, and they can significantly affect daily functioning. 17. Generalized anxiety disorder, GAD. GAD involves persistent and excessive worry about various aspects of daily life, including work, health, or social interactions, even when there is little or nothing to provoke it. This worry is difficult to control and can affect how a person feels physically. It's often accompanied by symptoms like restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance.